we're much more expensive than anywhere else, and we spend a lot of money on healthcare in the United States. Healthcare has become jobs bills for the US Congress. Healthcare is driving the economy in many ways. I'd love to get lobbying out of healthcare. I'd love it to not be a congressional issue. I'd like it not to be a political football.
We're talking today about healthcare, something that's very important for everybody at some point in their life. It's a really interesting subject. Over the past couple of decades, the amount of domestic product in almost every state in the United States, the largest contributor to domestic product is healthcare. And that's a big change over the last 3 decades. We're lucky today, we're talking with Etan Walls, who spent 20 or more years in all aspects of the healthcare business, physicians' offices, hospitals, insurance, practices, medical coding systems. I think he's going to help us understand what's happened and why it's happened, and are there things we can do that make it a little bit better. And to that end, he's written a book, The Mega Factory of Healthcare, Retooling the Machine for a Healthier World. So I'm in favor of health. So, Etan, when I moved back to America from Zurich, which is known to be one of the more expensive places in the world, there were only two things in Santa Barbara, California that cost more than they did in Switzerland. One was water. We don't do water well here in California. The other is healthcare. It seems like we have a situation here in the United States. Am I accurate? Do I not understand how it should work, or is it just confusing?
I mean, you're spot on, Dan. In Zurich, I think I read recently that the per capita cost of healthcare in Zurich is around 9,000 per person, and in the US, it's something like it's closing in on $13,000 per person on average. And Zurich is above the average for most countries in the world. Most countries are around $6,800 per person. So, yeah, we're much more expensive than anywhere else, and we spend a lot of money on healthcare in the United States.
You spend a lot of money. My impression is we don't necessarily get value for the money in the sense of objective metrics, a lower infant mortality rate, or longer lifespan, or even something more subjective, customer satisfaction. I mean, do we get something for all we're spending?
I think that if you are at the higher end and you're spending money out of pocket, you do get something for it. But it's a little bit difficult to get something from it when you don't understand the economics of it. Healthcare has become jobs bills for the US Congress. Healthcare is driving the economy in many ways. So, no, I don't think overall we're getting what we're putting into healthcare.
So what is you say it's jobs bills? So we're spending money.
Congress is incentivizing states, or previously has incentivized states to ensure that people aren't working. And because healthcare has gotten so big and such a big part of our economy, it is a major employer in the United States. Manufacturing has gone away. It's hopefully coming back, but healthcare is driving the economy, and the ancillary companies and organizations that feed into healthcare just keep on driving that economy around healthcare. And that's why on my book is talks about this mega factory, because it's so complex. You think about a hospital has employees in the hospital, but then they have vendors that feed into the hospital. They have insurance companies that have employees that are paying their employees because they are covering lives that are for patients that are being seen in the hospital. There are doctors groups that send patients there. There are food vendors around the hospital. There are, and on and on and on. You think about the old car factories in Detroit in the 40s, 50s, 60s, and the economy around the industry was just as important as the industry itself.
It seems to me to get a complete solution to your healthcare problem, you've got several different entities, you've said, providing services. They're probably all working to optimize their little piece. But is there anybody who cares about optimizing the entire solution to make it more effective? Or is by optimizing your piece doesn't necessarily make the overall outcome the best?
Well, no, there really isn't anyone looking at the whole thing right now. Congress thinks that they look at the whole thing, but they really, every time they touch healthcare, something breaks. We try to build, the Obama administration tries to build in an exchange plans and give healthcare to more people. But what ends up happening is that the trade-offs around that lead to massive consolidation within the industry, which raises prices. You look at some of the things that the Trump administration has. We're reducing fraud. That's great by ensuring that the Medicare provisions are correct. But on the flip side, people are going to, who shouldn't necessarily lose coverage, are going to lose coverage because the administrative burden is so high. So I think that when you look at it from a black and white perspective, the trade-offs are fine, but the reality is that there are humans in the middle of this, and trying to decode what's going on in the world of healthcare is very difficult. And if you're just one person without the resources to be able to understand that, you really need advocates around you. You need to ask for help.
Who do you ask for help? In my case, in a very simple situation, it seems like most of the things you buy, you can look at the prices, you can compare what are the options, you can make a selection. I went to get cataract surgery, and the bill had absolutely nothing to do with what was actually paid. The insurance company paid a very small fraction of what the bill was. The whole thing is massively confusing. Are there things I could have done?
The first thing that anyone should understand is the kind of the payment model within healthcare. Hospitals and doctors and insurance companies are incentivized and penalized based upon the outcomes or quote unquote documented outcomes of patients. They bill out using codes called CPT codes, and they attach a diagnosis to it. Then they get a payment back, or they're, not to get more complicated, but there's other codes that hospitals get. The best analogy I can give about how it works is if you walk into a supermarket, like a very large supermarket, and there's aisles of food. Down each aisle, think about that as a specialty. Okay. And each item on the shelf is one code of a procedure, one code of a test, one code of a consultation. Okay. And think of you going down that aisle. You're going down the primary care aisle. You're getting a well visit, and that's one code. And on top of that is a EKG and a blood test and an eye test and a consultation about smoking and maybe a consultation because my BMI is too high, right? And so all of those things, I'm taking the codes off the shelf and I'm putting them in my cart and I'm walking up to the cash register and I'm walking out the store. That's the payment model right now.
That's the way it works, which
That that's the way it works. But then about a month later, you get a bill in the mail for that. And it's like $5,000 for all of those things that you took off the shelf. And you look at the itemized bill, it's $5,000, but then the hospital pays like $400 for that bill. And because that's the contracted rate. And then your responsibility is $20. So we don't walk in getting an itemized bill of what you had done and what the real cost is and what your insurance company is paying. It comes later in what's called an explanation of benefits. And to most people, it is like Sanskrit. They don't understand what's going on. So what I tell people is think about it like the grocery store. And all of those codes are the things that you took off the shelf. You just bought the groceries a month ago.
it does explain what some friend of mine who works in an insurance company told me whenever I don't like the reimbursement from the insurance company, just call them and say there's been a coding error and just keep saying that until they change the code and then it will be fixed. Although it doesn't work all the time. It seems like it's a really complicated situation. I can imagine we could talk about this some more, but I think you've highlighted the reason for the complexity and how we've gotten into the situation. We may want to think about what do we do next? Or there's some ways, as you've said, you can fix the situation. It seems like everything Congress tries to do makes it worse, is what you've said.
Yeah, I'd love to get lobbying out of healthcare. I'd love it to not be a congressional issue. I'd like it not to be a political football. I'd love to just get it out of the world of politics. I don't know that that's possible because Medicare is such a huge line item, and I don't know that it's going anywhere. I'm not necessarily a believer of socialized medicine. I don't know that it'll work in this country because we have a capitalist in republic, and people really want what they want. There have been plans. We're going to be able to create these groups of patients called cohorts of patients. We're going to reduce costs. We're going to get them to do what they need them to do. Right? That's the thinking sometimes with insurance companies. The problem with that thinking is when the patient has choice, they want to do what they want to do. And unless they're part of the conversation, it never works. And it really hasn't been shown to work unless there is no choice for them, but the places where they want to go. So, what should we do? Understand your EOB, understand your explanation of benefits, really understand who your doctor is working for. Is it a private equity firm? Is it a hospital? Are they independent? That matters. An independent group will be more flexible with you about bills and ensuring that, and understanding what's going on. Probably a hospital and somebody who's owned by a private equity group may take less time with you to explain what's going on with the bill. If you're going in for a procedure, understand what your costs are going to be before you go in. There's a thing called the No Surprises Act, which ensures that people get informed of the cost before they go in for any procedure. And you can challenge the bills if they don't show you an itemized list before you get rolled in. Those are just two quick tips.
That sounds good. Thank you very much, Eden. It's really been a pleasure talking to you, very enlightening, and I'm sure we'll be talking again soon. Thank you.
Dan, thank you.